Hello, you. Yes, you. This is Usayome Sale from Ways Prime Time. Now, we appreciate your continued support for watching our content, following us across all our social media. But we've noticed, for those of you watching us on YouTube, 88.5% of you who watch our content aren't subscribed to our channel. Why? Now, if you are enjoying our content, you enjoy our shows, and you want to stay updated on all things Ways, it's time to hit that subscribe button below. Now, subscribing isn't just for you. It's for the growth of our channel. It helps us get bigger and better. With your support, we can continue to bring even more intriguing and exciting content. How about you subscribing right now and being a part of our community?
Good morning and welcome to Ray's Breakfast hashtag What Are You Saying? It's a beautiful Wednesday morning over here and we're thrilled to start the day with you, our valued viewers. On this vibrant platform, we tackle the conversations that matter most, and I am your anchor for today. My name is Oluchi Omenka, and today I'll be sharing the stage, the table, with my talented co-anchor Okikiola God's Beauty again. Okikiola Taiwo Jalupo, good morning.
Are you sure I'm not going to do Okikiola alias God's Beauty?
Maybe
Taiwo
because your
Jalupo?
name is so long, so I'm trying to fix everything that I know.
I don't even
together.
have all of my name right there. It's
Okikiola Taiwo. How many
it's
syllables
like
are that?
Okikiola Aisha Taiwo Jalupo. I used to give a lot of my teachers stress when they're writing my name because I'm like, I want 4 of my names there: my first name, my middle name, and my surname.
Interesting. Well, I have just very simple names. Oluchi Precious Omenka. Many times it's even Oluchi Omenka. You hardly get to hear the Precious. But good to see you here, girl. The girl vibe.
Yes,
how are you doing today?
Well, today I am happy. Let me say that. I'm happy. I woke up happy, not for any reason. I can't think about anything that has caused that, but I just woke up bright, happy, and I'm like,
and cheerful.
Another day.
I think it's even showing in your demeanor, the way you look. This wig of yours is giving Korean vibes. Any K-drama series that you're on to lately?
It's giving.
Probably inspiring the whole.
It's giving, give me some money. It's giving this February is for me, and that's money.
Honestly, the pressure is already getting worse. Do you know what has been happening lately? I've been reposting different Valentine packages for people, and I'm like, hey, all this repost I'm doing, hope I'm going to get some things, because what's all this?
I've just been hunting people with the fact that in case you want to buy Valentine's Day gifts for my friend, remember that I don't eat peanuts, so you know what to put inside. This package is for me and my friend, with my friend as the front man or the front lady. So I like chocolates. This is now telling the viewers, I like chocolates, but not with peanuts.
Okay.
I like a bit of shortbread, you know. Don't send me
flowers?
Teddy. Flowers, not plastic flower, but real flower. It will die though, but
too?
It will die, but
it still shows love.
For the aesthetics, it's necessary that it's not plastic.
That's coming from someone who is going to get around for a Valentine, but she's trying to whine us here. It's
How
fine.
do you know?
I know things. Let me not expose you this morning.
Okay.
All right, our dearest viewers, thank you for always joining us on this platform. Remember that you can subscribe to our YouTube channel at Official Upgrade TV, turn on your notification, and always be part of what happens right here. Let's go on a break now, and when we return, we'll look at the headlines across the globe as long as today in history. So please stay with us. We'll be right back. Welcome back, viewers. Thank you for staying with us. What are your thoughts on these historical milestones? I'd love to hear your insights and perspectives. Remember, you're the main ingredient in this conversation. We'd love to hear your thoughts on this. Our phone lines are open. Please call us on 07025007749 or 0701424220. All right, let's head straight to the headline stories across the globe. We have the Nigerian Tribune and the Guardian newspaper, starting with the Tribune.
So taking you through the Nigerian Tribune this morning, the headline reads, FEC approves 758 billion naira to clear pension liabilities. It okays £30 million on concessional loan to support students' housing projects and another 80 billion naira for reconstruction, expansion of Alau Dam in Borno. It says here again that 126 billion naira for MRI, CT scanners at OAU and others. And lastly, it says federal government says US, UK patients now seek medical care in Nigeria. Quite a funny story, but I'll take it as Nigeria has reported it. Another story here reads, brain drain. Nigerian doctors earn less than cleaners abroad, says Afe Babalola. Below that, we have police arraign suspended Ogun traditional ruler over assault and threat to life. Court grants him bail. I have another story here that says, gunmen attacks box, abduct travelers in Ondo. Obership crisis. Adeleke only followed process met on ground, says Oshu government. He releases details on SLK Ido, Adekunle communal crisis, and also says that 2005 document affirms Owa Obakun as prescribed authority over Ido Adekunle. We have another story here that says, use criticism against Nigeria to prioritize development, says Obi. And the last but not the least story here says 29 states removed speakers in 26 years. I would really like to talk first about this whole idea of 29 states removed speakers in 26 years. I don't think that that is enough for the number of or the amount of corruption that has happened under certain speakers in Lagos or even in Nigeria at large. If at every time that they can impeach a speaker, I would like it that every time a speaker messes up, does something that's not right, please be impeached. There's no time to, I don't think that Nigeria is at a phase where they should be able to take nonsense anymore. It's so critical. Look at loans are being taken. There's now fuel increase. There's inflation. There's dollar. Just recently, that's when Naira even gained some level of value. But then there's still so many crises that is affecting Nigeria that it almost seems like the government houses are untouched. So how do we now ensure that these people know that as you are getting into that position, you're getting into power, you're supposed to be working towards ensuring that the community lives and everything put under you is working fine. So 26 years is even, that's
It's
almost
too
like
long.
that's almost somebody's adulthood. That's how they gave birth to someone. And then imagine 26 years, there have only 29 states have removed speakers. How many of the speakers? It just said 29 states. It might even be 3 speakers in 26 years. So there's not enough fact here to even say that, okay, these are the number of speakers that have been removed for these social reasons. And this abduction thing, I just hope that we get to some place in, or some situation, or yes, place is a better word, in Nigeria where our security is now our main priority. We no longer hear of gunmen, this gunmen abducting these. The reasons, when I was reading the story, the reasons why they even abducted these people was not because there was information or anything. It was just that they have seen abducting people, kidnapping as another form of business. Every day somebody's paying one ransom or the other. So it's now like, yes, if I want to go into a lucrative business, I just need to get an illegal gun, have a few people, 3-4 people to put together, form a gang, abduct people, get ransom, because the police are not even doing anything or enough to ensure that this crime rate reduces rather than increases. From last year to this year, crime rate has increased.
And that's
to be
really,
sincere.
it's very funny to hear, because this is also inhibiting a lot of things that we should start making progress on. For example, tourism can be stifled because of insecurity problems like this. It
Exactly.
was, I think last year when we had a guest talk about tourism and the advantages that it has for us as a country, how we can position ourselves on a global scale. Hearing this now, foreigners would be feeling agitated or feeling
Every day,
scared
kidnap,
of
abduct.
coming over here. Our security really needs to be looked into. And going by your first story as well, the whole Senate thing, we need to have routine checkups. Somebody once mentioned that it's only in Nigeria that we make our leaders comfortable in their corruption. We don't get them uncomfortable enough to leave them. We need routinous checkup every single 6 months, 7 months, 10 months, 1 year, and not wait till something just happens and then you do one.
I agree.
Exactly. All right, let's see what The Guardian has for us. It says here, FG, NARD, CMDs, others bicker over state of health sector good rating. 4 oil firms post 386 billion naira profits amid uncertainty and security concerns. First Lady donates 100 million naira to Niger tank explosion. Victims visit IBB Abdusalam. PFN declares national rebate. Vows to expose corrupt leaders. World Cancer Day. Federal government to explore health insurance for cancer. Senate threatens to arrest IGP, Customs CG, FIRS, NNPCL, CBN heads over audit snub. And above that, we see EFCC arraigned 2 Chinese for allegedly cyber fraud others. GAC meeting ends in deadlock as parties disagree on Obasa's fate. And APC mulls indirect primary ahead of Anambra gubernatorial poll. And that's all the story for. Okay, there's one more. Mo Abudu showcases Nigeria's creative economy with Niger Crate in London. The Guardian really has, an array of different stories, the good, the bad, the neutral. The one that caught my attention firstly would be the donation of 100 million from the First Lady. And I think she's one First Lady that is very proactive, if I would say so myself. I mean, in recent times, ever since her husband, our dear His Excellency, got into power, I see how very active she is, always rendering aids, assistance.
Before then, I followed her and I saw that she actually does those things even before she got as a senator, because she was a senator, or she's still a senator. I don't know. I can't.
So beyond the First Lady title or tag that she has now, is something that's been inherent and is really remarkable and very commendable. And we hope that this relief helps to, take care of the victim. But another one again is very interesting. I'll touch on it very briefly, and I want to hear your thoughts on it. It says PFN declares national rebate, vows to expose corrupt leaders. For context, PFN refers to the Pentecostal Fellowship of Nigeria. Yesterday, they declared that Nigeria is undergoing a rebate, vowing that corrupt leaders will soon be exposed. And the body also announced a 40-day fasting and prayer, ahead of its 18th biennial conference themed The Rebirth of a Great Nation. And I looked at this news first of all, and what caught me was the fact that they said corrupt leaders will soon be exposed. By what means do they want to cause that exposure? Is it that they have some intels, or what they call them now?
Who will expose them? I think one thing that is very common with Nigeria is this fasting and prayer thing. And while fasting and prayer is great for anybody, for any nation, it does not necessarily translate into calling out bad leaders or exposing them in that sense. Fasting and prayer will only maybe aid the mind of, I don't know what it will do really, to be honest, but what I think is that we should go beyond this. Every time pray for Nigeria, every time pray for Nigeria, pray for your country, pray for your state, pray for your this. We need to now start accountability. Accountability does not have to do with I'm praying, or you are praying for a bad leader to change, you are praying for a bad leader to die, you are praying for a bad leader. What exactly are you praying for that is going to expose these people? What are you praying for that is going to get them to leave the office and go? If those bad ones go, is there an assurance that your prayer will now say that a good one should come?
I'm seeing this exposure not as a result of the prayer that has been made. It's almost like the leaders there have gotten some intel or information that these are the so-called bad leaders, and we're exposing them.
I don't want to say that
days.
There are some organizations, let me just say some churches and some mosques who take
money from politicians to help them with their campaigns and stuff like that.
And that leads me to say, sorry to cut you short, that the role of religious leader and religious setup should be cut straight up. It should be different from every political alliances and everything.
I'm not sure that is a thing in Nigeria. I think it's very embedded. It's just like traditional rulers too.
It ought to be a
thing. You cannot necessarily take out traditional rulers from the whole system, because traditional rulers are now being paid by the ruling party. As a traditional ruler, you are going to be paid by the ruling party. So imagine that, let's say that APC is the ruling party for that whole that tenure, and then you now say, I'm going to dissociate myself from. If they tell you to vote for this person, that this is the person that they are going to be giving your community for you to vote for, because of the number of corruption and bribery that has gone on there, you will not have a choice and you still agree. So you cannot necessarily remove traditional leaders and even traditional rulers from, or religious leaders, I mean, and traditional rulers from the system of politics. They are there. It's another side hustle.
Our problems is not very systemic. It's individualistic. It's not. It's not necessary. We have to classify them together. Oh, the political parties, religious leaders, or monarchs. Is individualistic, and that's why, you know, these things keep happening. Very interesting story. I'm sure some of them caught your interest, but this is where we wrap up the headline stories. Today is Wednesday, and Wednesday is usually our health and wellness segment. We want to commemorate the celebration or the cancer awareness that happened yesterday, February 4th. And so we have an expert guest who will be taking us through the dynamics of cancer, childcare, and balancing love and treatment. So it's going to be a packed show. All right, we'll take the short break. When we return, we'll welcome our guests and start the hot topic. Stay with us. We'll be right back. Welcome back, viewers. Thank you for staying with us. In commemoration of World Cancer Day, marked every 4th of February, Ray's Breakfast will be discussing the dynamics of this, however, focusing on children on our Wednesday special health and wellness segment. When a parent is diagnosed with cancer, the entire family is affected. The emotional and physical toll of cancer treatment can be overwhelming, leaving parents worried about how to care for their children during this challenging time. Balancing love and treatment is a delicate dance as parents strive to maintain a sense of normalcy and stability for their kids while also undergoing life-saving treatment. In this discussion, we'll explore the complex issues surrounding childcare and cancer, offer support, guidance, and hope for families while navigating this difficult journey. Of course, we're pleased to have Dr. Motunranyo Adekunle, a pediatric oncologist, join us today. Good morning, doctor.
Good morning, Oluchi.
Good morning. We're so glad to have you here today to discuss this topic. And reports reaching me says that you're very enthusiastic, passionate, and well versed in this. So we're super glad to have you here.
Yes, exactly.
Happy to be here too. Thank you.
All right, let's kick the conversation already. What are the most common types of cancer found in children, and how do they differ from adult cancers? Because today we just want to focus on children cancer, because we hear a lot about adult wounds and people are more aware of adult cancer. But let's focus on children. What are the most common types of cancer found in them?
Okay, thank you for focusing on children. It's a long-awaited thing, Children are not young adults, so we keep saying it. There's that need to focus on childhood cancer. So common cancer in children, we have the blood cancer that we call ALL, acute lymphoblastic leukemia. It's common. We have kidney cancer that is called Wilms tumor. That's another cancer that is common in children. We have the eye cancer that we call retinoblastoma. You see the eye of that child that bulging out. So that's actually something that we find, especially in our environment, that it's also common. There are other malignant cancers that are common in children, like in our environment, bucket lymphoma, though the trend is now reducing because that is actually associated with HIV. And since there's actually that awareness and treatment of HIV infection, we are seeing less of those children having bucket lymphoma. However, it's still there. So that's another cancer that we see in children. There are other cancers, the bone cancers called like osteosarcoma, and brain tumors, children to come down with brain tumors. So we see lots of those ones. So these are common childhood cancer that we see in our environment.
All right, before we take the conversation, a step further, we want to also know the known causes or risk factors for childhood cancer. Is it hereditary, environmental, or a mix of both?
Yeah, so majority of childhood cancer, you don't have a cause. So it's unknown. You can't say this is what is causing it. However, there are some that are hereditary. For instance, I mentioned the eye cancer called the retinoblastoma. So that can be hereditary in about 15 to 30% of those that have it. So there are other factors, but has not been so well documented. People will talk about exposure to radiation. So if you stay close to a mast, you understand you have the risk of, that radiation coming to your bone. So those kids have been associated to have the risk of having cancer. And then some chemicals of solvents, even some kids that have had previous treatment for cancer, some of those drugs that we give can make them have another cancer. And some that have had radiotherapy for one reason or the other, they are prone to having cancers. But in most cases, there's no known cause for childhood cancer.
Thank you very much, Ma. It's more like every time we have a very strong conversation like this, it's always a term for us to learn, even as anchors and as well as our viewers. As you were mentioning the fact that there is no known cause to child cancer, it brings me to wonder how knowledgeable we really are as Nigerians to even, or as parents or caregivers or even guardians, to know that, okay, what kind of signs should we look out for when we notice that, okay, something is wrong with the child, knowing that I don't know if there are symptoms, but then just knowing that you cannot necessarily know a particular cause. What are the symptoms that we need to look out for as a parent, as a caregiver, to know that, okay, these are symptoms of maybe, like you mentioned, the retinal. Permit me, those English are really big, so permit me to just narrow it down, like eye cancer, kidney cancer. What are some of these signs that we should notice in kids?
So there are ways they actually present. And for instance, a child has been born, the eye was fine, and suddenly you are seeing a cross eye. That cross eye was not even there from birth. And you start seeing people talk things like, maybe they should just put breast milk. No, something is most likely going on in that eye. Or, when you want to take pictures, especially in the dark, you will see that the dark part of the eye should be red, but you're not seeing that red spot. That tells you there's something at the back of the eye. That's where the cancer from that eye grows. So it's something parents should look out for. especially in children, after they are birth to the age of 5. Now you just see a mass growing on a child. You see a lump. Don't just take it like, oh, this lump is there, especially if it is painless. That tells you that maybe there's something. Or in our environment, especially, you find out that, oh, this child is suddenly white, pale. They take to the hospital, they tell you that it's malaria, they treat malaria, they give blood. And the child comes back again, 2-3 weeks time. Oh, the child is pale again. And they're still treating malaria. It's not likely to be malaria. You treated the malaria. So why is this child suddenly pale again? Most likely the bone marrow is telling you something is wrong. I'm not producing those cells that I should. Because we find this one coming late. Some would have received 6-7 units of blood just being treated for malaria and typhoid, which is something very rampant in Nigeria. No, something is wrong. You're bathing your child and you just suddenly feel a mass in the tummy. That's the one of the renal home. Most time it's not painful. You just feel that. And parents do feel it. Those that come, they will say, oh, I just suddenly felt this. However, most of them will say, oh, I started to watch. I started to wait and see. But it keeps growing. That tells you there is something wrong. So these are things to look out for in a child. Sometimes if it's a brain tumor, most times people don't actually pay attention. Sometimes you see a child suddenly deteriorate in academic performance, and parents keep beating and beating and beating and saying, why are you no longer doing well? Perhaps something is sitting in that brain. Why is this child not working? Why is the gait now abnormal? Why is this child working, in a funny manner? That tells you, maybe there is something in the brain. These are some symptoms that, people should pay attention to say, oh, there's something wrong. And in some cases, you will see it's obvious. The eye is popping out. You are seeing that jaw mass, Those are, signs of cancer that requires attention.
Very interesting. Something very remarkable that you mentioned is how that we as Nigerians or, many African parents can easily dismiss certain symptoms for malaria, typhoid, cough and all of that. But let's talk about how these diagnoses actually work. How is cancer in children diagnosed and how different is the process compared to adults? Are there complications or does it go through a lot of processes to even confirm that this is cancer?
So the diagnosis, they are myriad of things we do. But you understand, if you notice, I'm not talking of breast cancer or something because cancer in children is actually different. The trend of cancer you see in children is absolutely different from that of adults. Okay? So how do we diagnose? When we see them, we take the history of what is this, how long has it been? That tells you something. If it's something that just been sitting out there, it may just be something that's not so malignant or something sitting deep. If it's something that's multiplying rapidly, this thing was just there 3 days ago, it tells us, oh, most likely this is a type of cancer. So, oh, this child just required blood, I've given blood, it's failed. It's telling you that the bone marrow, that's the place where all our blood cells are being produced. There's something wrong there. So from our history, it will guide us to say, oh, this is most likely the type of cancer we are dealing with. Then we go ahead and investigate, okay? Of course, due to limitation of funds, we are always careful just not to roll out investigations just like that for parents to do. So you focus on, oh, based on this history, based on what I've touched, based on what I've seen about this child, this is what I'm thinking of, 1, 2, 3. I'm going to investigate along this line. If it's an abdominal mass, no. I'm going to do abdominal ultrasound or a MRI of that abdomen. Do you understand? If it's a jaw mass, I'm going to request for an MRI of that jaw. If it's something in the bone marrow, like the child requiring blood every time, then I'm going to go into that bone marrow, take some parts of it, go look under the microscope and see what is happening in the bone marrow. So based on the presentation, that's what guides us on the investigation to do. Oh, this child is not performing well, this child gait is abnormal, this child is vomiting excessively, and I'm thinking, oh, most likely it's a mass on the brain. Then I'll request for brain MRI or CT scan. So based on the symptoms, that's what guides us into investigation that we do for them.
Wow. It's almost like I'm getting lost in and out of all the information that you are giving us. And this is me trying to now think, I'm just thinking about what personal experience can I relate these things to? It's very common that most times you see Nigerians saying that, oh, it's not that deep. They don't. The idea of cancer in children self is almost like it goes over the head of a lot of people that it's not possible. The things that are common are cancer in adults, breast cancer, blood cancer, and all of that stuff. So how far are we going with awareness of childhood cancer, and how do we now educate these like people more about the symptoms, the process of, you know, getting to the hospital, what kind of resources they should, you know, look out for and have? Because Google, I will always say, it's not your friend, because if you see certain symptoms, just like you have mentioned, and I go on Google, all you start seeing is that the child has died, it is over. Google gives the it is over kind of feeling. So how do we now raise awareness for these things, and how do we educate people on symptoms that they should look out for?
Okay, so regarding awareness, we do a bit, you know. Like, for instance, February 15th is the National Childhood Cancer Day, and we are going out there to raise awareness about childhood cancer. One thing people should know about childhood cancer is that most are curable. Most childhood cancer are curable. But what is affecting the outcome in Nigeria is late presentation. So not just parents and families, even healthcare professionals need to know that they should refer appropriately and promptly. You will save a life by doing so. So, of course, there are bodies there that talk about childhood cancer. You know, February 15, you see people, you know, out there raising more awareness, especially in Nigeria, about childhood cancer. On social media, yes, I'm not saying we are doing enough. Many people are still very oblivious to the fact that cancer exists in children in Nigeria. In fact, sometimes when I tell people, I look like children, how come, where, you know, even literate. So we need to do more. That's one thing, being here, what I think I'm doing, you know, telling the populace that come, childhood cancer is there. In fact, WHO declares it as a public health threat at this moment, because the increased rate, it's alarming globally. We are seeing many more children come down with cancer. But, you know, when you catch them early, they can live normal life after treatment. In fact, that is the beautiful thing about it as against adult cancer. So we create awareness through our social media. When parents come in and, you know, we diagnose a child, of course, it's like, no, this is unbelievable. They come to the, you know, to the reality that you may not have a child with cancer. And through their families and the rest, they help even in spreading the information further. We have many of those parents committed to this, you know, to this goal of reaching out there. We have even schools, you know, supporting, you know, creating awareness about childhood cancer. But I know we can do more in Nigeria, you know, for people to know that childhood cancer actually exists.
Oh, thank you so much. You mentioned that WHO has declared this as a global threat. Now, I want, based on statistics, to inform the viewers and ourselves, which location do you think we see this very prevalently? For example, do you think this childhood cancer is more prevalent in African areas or in the Western world, or, you know, so that we can have an idea of how much of a risk it is for us here?
So 80% of childhood cancer occur in sub-Saharan Africa. 80%. So you can see that it's a disease of the African. The whites are paying more attention. Do you understand? They are having more survival rate, but it's a disease in sub-Saharan Africa. So it's something commoner in this environment than the Western world. They hear more about their own because they keep more data. You understand? Some childhood cancer, they will die at home. Nobody will know. But that doesn't occur over there. All right? So you might not hear so much about data collection and all the rest in Africa, which we are now working on, because when you know the variety of cancer you have, because it differs too based on the environment. You know, I told you before, we used to have HIV-related cancer. It helps you to plan that, okay, what cancer are we dealing with, especially in Nigeria? What are the first 5 commonest cancer? That would guide you in, you know, diverting resources to those cancers, because all you want is that survival rate to increase. So in sub-Saharan Africa, we have majority of childhood cancer.
If you say in sub-Saharan Africa we have majority of this, it leads me to wonder, could it be that some lifestyle changes actually contribute to this for Africans? I want you to touch on that a bit. Because I know you mentioned that the causes there are different kinds of causes and maybe not eventually environmental, but if it is sub-Saharan thing, are there lifestyle changes, African lifestyle, things that actually contributes to this cancer in children?
So most of those information, they are unknown. For instance, beyond HIV infection, exposure to radiation, you understand, the lifestyle, for instance, you can't say, oh, there's not be anything to say, oh, the herbal concoction people take, it's not a scientific thing to say, oh, causes it. However, we see some trend. We see that, okay, people perhaps that have had, funny lifestyles in terms of what they take, we see lots of them. There is no scientifically proven. So we can't just nail on that and say that that's just the reason why it's like that, okay? But I guess most time, for instance, in the developed world, they have the screening methodology well in place. Like the high cancer that runs in the family, they do this genetic screening. If they have one child with that cancer, they do the genetic screening to be sure that no other child comes down with it. We don't have that robust as technology here. So you could find 2 family members even coming down with cancer. So perhaps our screening method not there, and we are not able to prevent some of them. But other than other things like, the fact that it runs a family doesn't mean it doesn't run in those family, but there's no scientific proven reason, to say that some of the things we use, had the reason for it. It could be, it takes us to check, right, scientifically.
Ma, can I know about what kind of support parents who have brought maybe their children or their child who has some form of cancer, let's assume that it has not been diagnosed, can I know what kind of support that like organizations, maybe government hospitals or private hospitals, I wouldn't know what parastatal that you work, how do they, what kind of support is available for these people, and then how far does the cost of treatment go in terms of radiography, chemotherapy, and all of that?
Care of childhood cancer is huge. On the family, it's a huge burden, I must say. Financially, psychologically, I've seen broken homes just because a child has cancer, all right? And you can imagine buying chemotherapy worth of millions, paying for investigations. And most of these people are low socioeconomic class, they can't actually afford it. And that is not good for us because it makes it easy for them to abandon treatment. In fact, that's one of the problems we face in Africa and in Nigeria. Treatment abandonment rate is extremely high. Some parents cannot just cope. By the time they stop treatment, what they've done is they've confined their child to die. So the support, sometimes we get some non-governmental organizations, they will just come and donate chemotherapy, and say, oh, for any child with cancer, and that cushions some of those effects, like, oh, we have some chemo for you. You find individuals walking too and say, oh, we want to help any child with cancer. I guess some that have had relatives or family with cancer in the past, they come in occasionally and help. Recently, we had someone that it's even grown, 35 years. She came to celebrate her birthday because she had cancer when she was young and just came to, celebrate her birthday with those kids and then give them something. So that comes in. However, it's not enough if you look at it. Because if you look at the cost of doing all of these things, an average Nigerian cannot afford it.
That's quite sad.
So they need more support. That's the truth.
Very true. This has been very insightful and expository, honestly, because we've gained some knowledge on the dynamics of cancer. We'll take a short break now. When we return, we'll look, into this topic further. So please stay with us. We'll be right back shortly.
This season on Heartlines, we're committed to making a difference in people's lives. So Heartlines, in partnership with Veda Consult, is offering 12 free slots of counseling every quarter for people in need of professional counseling. Additionally, we're taking on 2 pro bono cases for individuals navigating a challenging divorce. To participate, please send an email to counsel@vedaconsult.com with your story. Our team will carefully review all submissions and will contact all the shortlisted candidates. Heartlines is live Mondays to Fridays at 10 p.m. So engage with us.
Welcome back. Thank you for staying with us. It has been a very insightful and expository one with our expert guests as we've been unraveling every question and answer and comment as regards childhood cancer and, the care and treatment for it. Dr. Motunranyo, are you still with us?
Yes, I am.
Okay, thank you so much. So before we continue with, the treatment, the financing for it, the support and all, I want to ask you, based on your expertise, can you share some personal experience of a child cancer survival and how it happened, how it just, happened? Let people be encouraged to know that being diagnosed with child cancer, it's not the end of life. So let's hear a testimony of how you handled such.
Oh, okay. So we have a number of patients that, they are alive, they are doing well. Some have completed their treatment. They went through the hurdles of, looking for money, buying chemotherapy, the kids coming down with complications of the chemotherapy, losing their hair, vomiting, infection, multiple hospital admissions, not going to school. And, when they are done, and everything, returns, the hair start growing and the parents bring them back for follow-up. You are doing, because you do assessment afterwards and you're checking, you are not seeing it there. It's really something overwhelming. That's one of the things that gives you joy. That's one of the things that keeps me going, knowing that, okay, it needs us to get it right, have the right resources. These children can actually survive, okay? Sometimes we've had people take up the care of, someone that is extremely very poor, that can never imagine where he or she would get that money for. I know they were able to scale through. So when we see those patients come in, they come in for clinics, it's something joyful. And they come in also sometimes to encourage those still in treatment. When they see them and they're like, oh, you mean your child was here before? You mean your child also had chemotherapy? They're encouraged to continue, So we have a number of them like that, they have completed their treatment and they're actually doing well.
All right, I know you mentioned that if it is diagnosed early and treatment starts on time, they can get back on their feet and they have a long time ahead of them to still do great things. But I still have some fears as regards how short-lived this treatment can be. Could it be, have there been cases where some of these children were actually treated, they got better, and there were probably hints or, the possibilities of it coming back again, probably not as cancer, but affecting something in their development later on? Let's be aware of such.
Yeah. So there are kids that relapse, okay? The cancer comes back. You're done with your treatment, especially the blood cancer, like that leukemia I mentioned, We've had some kids that they are through with their treatment, some months later, the symptoms just come back, all right? That happens anywhere in the world. But where our own limitation is the fact that at that particular time, for that something like that blood cancer, what you have to do is to give them very high intensive chemo, and then you do bone marrow transplant. And then the parents are stopped because they cannot travel out to the bone marrow transplant. They cannot afford it, all right? So we have some like that, and it could be very it could be very emotionally, it could be traumatic, But what keeps us going is the fact that you can't say this is a child that relapsed. So you want to keep on treatment, you want to keep on watching them and trying to pick anyone that relapsed. For those like the Wilms tumor, when they relapse, if they come in early, you can still salvage them really. They can still do extremely well. So yeah, there are cases like that, but that doesn't mean you stop treatment. For those that can afford, we've had a couple of them that could afford to go outside the country when the relapse came up. Yeah, it's good. They will have the bone marrow transplant, and hopefully it works, because not every one of them that it actually also works for. So it's, yeah, relapses, they are nightmares
Happen.
for us, really.
Can I know averagely how many sessions of, let's say early detection happens and that you have been able to diagnose the child with whatever form of cancer, how many sessions of chemotherapy averagely would the child need before you can say the child is probably in the safe zone, and then you can now do maybe outpatient treatment or
Mm.
I mean, if we were to narrow it down, how many chemotherapy averagely?
So it depends on the cancer. So for the blood cancer that I said here, though, when they come in bad, and we hit them with chemo hard. So the initial phase of couple of days to weeks, they are in the hospital because they might need blood, they might need that blood component that we call platelets. All right. But the whole treatment spans for about 2 to 3 years. But of course, they're not in the hospital for 2 to 3 years. So they will be coming in for admissions, regularly, depending on the need. For the solid tumor, in fact, some of them we just admitted for like 1 or 2 days. Why? Because their chemo can just be one-off. We watch them and they go home. They'll come back the next week. We come back weekly for their chemo. And those on the treatment spans for about 12 months to 18 months, depending on how advanced the disease is at the time we're picking there. So treatment spans sometimes 1 year, 2 years, and maximum 3 years.
So where's now the psychological support for parents or guardians who now have, because you have mentioned how emotional these things can be, how psychologically draining these things can be. Is there any form of support apart from family and friends or that hospitals or health professionals give to parents or guardians of these children? I know that the children at some form or way, whenever they start treatment, there's conversation, so it's easily encouraging to just say, oh, you'll be fine, you'll be this. But these are parents who are adults already, and it takes a lot of more convincing than convincing a child that you'll be fine to tell an adult. So is there any support whatsoever, emotionally, psychologically, for these people to be able to even carry
Yeah.
on rather than taking the children out of the hospital when they can't afford these things anymore?
Yeah. So there is. So every program we carefully make sure that we have psychologists involved. And, they are more trained in relating, with them when it comes to things like that, going to the root of, what is happening in their family, how is this diagnosis affecting them as a womb. So psychologists get to see them. And the amazing thing is that among themselves, I mean, those parents, they cheer themselves up. So, we have chemo days, they come in, they see themselves. You see, they form that bond, like they are in the same boat. So they form that bond. In fact, when you hear them talk, they practically have become like family members, and they give support. You find, oh, this one cannot do this. You find this one reaching out to say, okay, I still have something left. I say, they reach out like that. And then many times we get, for instance, we see that, oh, these parents, they are not doing well and all the rest. We get people like they, apart from their family, about to call in, the spiritual leaders of some, to come and, let's have a talk. How are you helping these people, beyond the front and all the rest? Because sincerely, it's a huge burden that, can tear home apart. So we get the psychologists, we get the social worker involved, you understand? And hopefully, as we have many more survivors, that's one thing they do in the developed world. They get them involved. I've had training where, one of the consultants in that hospital, was a patient. with childhood cancer and now a grown-up person, a doctor, a consultant. One of the nurses was a patient. It's like, it's something that it's actually encouraging to those friends when they see that you mean you were like my child, and not only are you alive, but you're a doctor not treating them. So we hope that we get to that level, someday, okay, to also ensure that that's a form of support for those parents.
Is there a way you can highlight certain hospitals or maybe government hospitals or private hospitals who are very particular about child cancer, where if any parent actually sees any symptoms or signs can go straight to that place? Because it's not enough that we just talk about it generally. They also need to know where to go. So where do we go when these kind of things happen?
Okay, so I work in Lasut, Lagos State University Teaching Hospital Ikeja, okay? And we have a robust team, that manages childhood cancer, all right? LUT also manage childhood cancer. When it comes to treatment of childhood cancer, not all hospitals can handle it. So we get referral from many government hospitals as well as private hospitals because it requires trained expertise, you understand, just to make sure you're doing the right thing well. Okay, so for other government hospitals for now, I know they still refer. Okay, yeah, UCH Ibadan is there, but in Lagos, for government, LUT and LASTUT, are the prominent hospitals that manage childhood cancer.
All right, this has been very insightful. Thank you so much, Doctor, for contributing and, opening our minds to understand how this works, and really hope that, children who are probably having this cancer gets the treatment that they deserve, because it's a really sad thing to talk about. Honestly, as much as you've been enlightening us, I'm just having this picture in my mind that a child can actually have cancer. Children are delicate, so seeing them go through such pain can be very, very saddening. But thank you so much for enlightening us. We hope to have you on our show again.
Thank you for having me. Thank you.
Thank you so much. Thank you, Okikiola, for joining us. Till tomorrow. Tomorrow we're discussing some social concern issues, and the table is going to be full. The ladies and I, we're going to be breaking down topics tomorrow, so you don't want to miss it. See you tomorrow by 8 a.m. Bye.
Hello, you. Yes, you. This is Usayome Sale from Ways Prime Time. Now, we appreciate your continued support for watching our content, following us across all our social media. But we've noticed, for those of you watching us on YouTube, 88.5% of you who watch our content aren't subscribed to our channel. Why? Now, if you are enjoying our content, you enjoy our shows, and you want to stay updated on all things Ways, it's time to hit that subscribe button below. Now, subscribing isn't just for you. It's for the growth of our channel. It helps us get bigger and better. With your support, we can continue to bring even more intriguing and exciting content. How about you subscribing right now and being a part of our community?